So with a regular ankle sprain or a lower ankle sprain, it's more down the bottom down here, the ligaments coming off the fibula onto the calcaneus and the talus here, or on the inside coming off the tibia onto the calcaneus and talus here. And it's more of an inversion, eversion sprain, kind of the typical one where you step on someone's foot and you roll your ankle, or you step in a hole and you roll your ankle. And we're dealing with an ankle sprain. It's more up here. It's higher up. And we're dealing with the ligament that attaches the tibia and the fibula together. So it's higher up here, and the back, and at the front it's kind of attaching up through here. And one of these things happen is it's a kind of an impact sprain, is that can separate, and you have a membrane running in between that gets sprained as well. So this can happen when you're wearing a boot or a skate or ski boot or something like that, and your ankle gets twisted funny. Instead of being able to bend down here, it gets bent higher up, and that can actually separate these two bones and lead to a high ankle sprain. And the one that we always want to check as well is we want to check that when you sprain that high ankle sprain, that we don't fracture our fibula at the same time. So one of the tests we'll do for a high ankle sprain is we're going to come in and we're going to squeeze and try and pull the tibia and the fibula back together again. If that's quite painful, chances are you have high ankle sprain. Lower ankle sprain is more painful when we do this. High ankle sprain is we squeeze here and it's quite painful. We can always tap on that fibula, because if you fractured it, if we tap it or we put the tuning fork on it, it's going to be quite painful as well. One thing we'll do is we'll send you out for an x-ray just to confirm that that's either broken or not broken. We'll actually probably see as well, we can see that the tibia and the fibula have kind of splayed apart as well. And that's how we test for the high ankle sprain.
To help treat a high ankle sprain, we can get you into an air boot, which goes around your foot and then helps to stabilize the tibia and fibula. That would take around 2 to 4 weeks to heal, but if you actually fracture that fibula, then it might take longer. And if you are looking to speed up the healing, you can come in and we can do some laser, which would help to heal the ligaments, or we can do some IFC, which would help to control the swelling. If you're at home, you can do some contrast bath or some icing. That would also help to control the swelling. And then once you have the pain and swelling controlled and it's lessened, then we can give you some weight-bearing exercises and some rehab exercises.
So as we talked tonight a little bit about a high ankle sprain, if you have any questions or comments on anything we talked about tonight regarding the high ankle sprain, you can always email me at jgoolsworthy@goolswells.com or talk to me on Facebook. If you have any other topics you're interested in us talking about, you can always send them to us and we'll certainly research it and get back to you. As always, I'm Dr. Jeff with co-op student Meghan, and we've got your back.